Good evening again, everyone. It is great to be back with you again. Tonight, we are going to talk about pregnancy and sexually transmitted infections. However, before we get started, I want to invite you all to please subscribe to my channel. I have loads and loads and loads of viewers, but I need you to convert to subscribers so that you will get notification of all of the new material that will be coming forth, and we will be having some great material coming up. So I want you to hit the subscribe button as you listen and continue on with me. We talked about sexually transmitted infections last week and how there are like 30 different types of viruses, bacteria, and parasites that are transmitted sexually, whether you're having sex either oral, anal, or vaginally. What we need to consider is that during pregnancy, it is possible to transmit sexually transmitted infections to your baby. And you probably are wondering, how in the world does that happen? Some of the sexually transmitted infections can be transmitted through the placenta. A lot of them are transmitted through the birth canal, meaning that as your baby is being born and coming through the birth canal, the baby is able to pick up sexually transmitted infections in that way. When you become pregnant and you go for your prenatal appointments, being tested for sexually transmitted infections is a part of the usual testing that you will get on your first prenatal visit. And that test is either a blood test, or when you have a vaginal examination with a speculum, that is when secretions are obtained and can be sent and looked at, cultured and sent to the lab, and also looked at under the microscope. So these are the ways that you would get tests. Your testing would occur on the first prenatal appointment and during the last 3 months of your pregnancy, and possibly also at the time that you go into the hospital to have your baby. Now let's talk about some of the problems that can come up with a sexually transmitted infection being transmitted to your baby. I'm telling you, as I said last week, this is no joke. This is no joke. So some of the things that can happen: sexually transmitted infections such as trichomoniasis can cause you to have early labor. And when you go into early labor, you are at risk for your baby being too small, meaning weighing not enough for how far pregnant you are, called a low birth weight infant, meaning less than 5.5 pounds. Other things that can occur is blindness. With gonorrhea, gonorrhea can cause infection in the eyes that could lead to blindness. And so you will notice that after your baby is born, they want to give the baby drops in the eyes, and that is to prevent any possibility of there being infection of gonorrhea into the baby's eyes. Other things that can happen is pneumonia. There can be infection in the baby's blood itself because, again, the infection can go through across the placenta, which is the bloodline between mom and baby. It can also affect the baby's nervous system. Syphilis, if it is not picked up, can go on to progress to be late syphilis and not be picked up until childhood, or even when your child is a teenager. And late syphilis that was transmitted during pregnancy and during labor and birth can have the same kinds of symptoms that you would have for third stage syphilis in adults, which can be things such as nervous system disorders, blindness, insanity. Believe it or not, insanity. These are things that can also happen. There can be deafness from sexually transmitted infections. There can be things such as your baby having hepatitis, which hepatitis B is a sexually transmitted infection. We discussed that. There can be chronic liver disease. So there are many, many things that can happen with sexually transmitted infections during pregnancy. That's, if it's not treated, can be transmitted to your baby. I have a lot of free information on my website. The website is thecarab, THECARAB company.com, and look for products. And there you will see a number of free information sheets that you can download. So I want to invite you to take advantage of those free resources. So this is the information that I have on pregnancy and sexually transmitted infections. One other thing, before I close out, the question is how would you prevent this? We know that sexually transmitted infections are transmitted, given back and forth by having sex. And if you have more than one sexual partner, then you will increase. This is on both sides, the woman and the man. If you have, all you need is one person of that union to have sex with one other person, and now you and that other person are exposed to everything that that third person has been exposed to. And you don't know every place that they have gone, okay? So to be able to prevent this is to be in a long-term, mutually being both people, being monogamous. And the other is the use of condoms. Condoms will help to protect you from sexually transmitted infections. As was mentioned in the video that we did on contraception, even if you're using a birth control method, that birth control method does not protect you from sexually transmitted infections. So this is my information for tonight. I hope that you will share this with your friends, share this with your mom and dad. You may not want to do that. Mom and dad, sisters, brothers, aunts, uncles, nieces, nephews, colleagues, girlfriends, and boyfriends. Thank you so much for your time. Have a great evening. Bye-bye.